swaying or inability to maintain balance while standing with the eyes closed is considered a positive finding in what test? A. Romberg's test. B. Test for ataxia. C. Gait test. D. Rapidly alternating movement test. The answer is A. Romberg's test. Romberg's test is an evaluation of both proprioception and vestibular function. The patient is asked to stand with eyes open, then to close their eyes and remain still. Any tilting or loss of balance is considered to be a sign of either proprioceptive or vestibular impairment, and should be evaluated further. Gait test assesses for gait abnormalities. Rapidly alternating movement test is done with the patient seated with their hands on their thighs. They are asked to rapidly turn their hands over, then return them palms down to their thighs 10 times. This test is evaluating for dysdiadochokinesis, or inability to perform rapidly alternating movements. Ataxia, or the loss of control of bodily movements, is not a specific test, but rather a clinical finding. A 46-year-old patient presents with dysdiadochokinesis, an inability to perform rapidly alternating movements. What condition is the most common cause of dysdiadochokinesis in adults? A. Lesion in the pons. B. Multiple sclerosis. C. Parkinson's disease. D. Cerebellar lesion. The answer is B. Multiple sclerosis. In adults, the most common cause of dysdiadochokinesia is multiple sclerosis. Cerebellar lesion is the most common cause of this finding in children. This symptom is not a normal finding in Parkinson's disease, or in pontine gliomas, tumors of the pons, though neurological impairment or ataxia itself may make rapidly alternating movements difficult. A 26-year-old woman presents to urgent care after a bike accident in which she got a bad bump on the head. She was not wearing a helmet. She must now be assessed for increased intracranial pressure. All of the following are signs of increased intracranial pressure except dash. A. Effort-related or positional headache. B. Altered consciousness. C. Migraine or that persists after headache has resolved. D. One or both pupils are dilated and unresponsive to light. The answer is C. Migraine or that persists after headache has resolved. Increased intracranial pressure can be chronic or acute. The nurse must assess for pupillary response, level of consciousness, and quality of headache if present, in addition to motor response. Migraine or that persists after headache has resolved should be evaluated for stroke, transient ischemic attack, or arteriovenous malformation. Which of the following terms denotes neurological impairment of the ability to speak or understand language? A. Apraxia. B. Ataxia. C. Dysmetria. D. Aphasia. The answer is D. Aphasia. Aphasia is the term for neurological impairment of a person's ability to speak or understand language. The other terms listed all denote various deficiencies. Ataxia is a loss or lack of coordinated motor function. Apraxia describes the lack of motor planning or inability to execute a specific intentional movement. Dysmetria is an inability to judge distance when attempting movements such as grasping at a nearby object. The nurse cares for a patient who is prescribed phenytoin for seizures. Which of the following serum drug levels would most concern the nurse? A. 10 microgram per milliliter. B. 12 microgram per milliliter. C. 20 microgram per milliliter. D. 16 microgram per milliliter. E. 8 microgram per milliliter. The answer is E. 8 microgram per milliliter. The therapeutic serum phenytoin level is between 10 to 20 microgram per milliliter. 8 microgram per milliliter would be below the therapeutic level and may be due to non-compliance by the client or increased metabolism of the drug. The other options are within the listed therapeutic range.